Welcome to Texas Briefing, where we untangle the policy challenges shaping life in the Lone Star State, one series at a time. This show is coming to you from Rice University's Baker Institute for Public Policy in Houston, Texas. This three-part series is focused on reproductive health in Texas. And in this episode, we're focusing on a topic a lot of parents, perhaps understandably, don't want to talk about: reproductive health of Texas teenagers and teens' access to contraception. But as we'll get into, in a state that has one of the highest rates of teen pregnancy, this is a pretty important issue and one that state policymakers should be looking at. I'm Elena Marks, a senior fellow in health policy at the Baker Institute, and your host for this series. Many states allow minors to consent to their own contraceptive care, but in Texas, that's not the case. Even teenage parents who can consent to the medical care of their own children need parental consent for their own birth control in Texas. Why does this matter? Well, Texas has one of the highest teen pregnancy rates in the country. Nearly 1 in 5 high schoolers are sexually active, and many of them report that they want to use effective birth control methods, but they're unable to raise the issue with the parent. And some parents, of course, argue that allowing their children to access birth control without their consent is a violation of their parental rights. At its core, this is a health policy issue. Here with me to discuss the data and different perspectives on teen access to contraceptives in Texas and what it means for health outcomes is Dr. Kari White. Kari is a non-resident fellow in maternal and reproductive health here at the Baker Institute, and she's also the executive and scientific director of Resound Research for Reproductive Health, as well as a former tenured associate professor at the University of Texas at Austin. She spent more than 15 years researching how policy changes affect health care, access, outcomes, and people's experience in seeking and obtaining care. So, Kari, thanks so much for joining me today.
Oh, well, thanks for having me.
So let's start at the beginning. We have 1 in 5 Texas teens who is sexually active, and yet they're not able to consent to their own contraceptives. How does that fit in the grand scheme of things in terms of state policy in Texas and in the rest of the country?
Yeah, so as you noted in the introduction, Texas is one of the states in the U.S. that doesn't allow teens to consent to access contraceptive care. In 23 states, teens can consent for their own contraceptive care. In 5 additional states, teens of a certain age, 12 to 16 years old, can consent for their own contraceptive care. But in Texas, there are really narrow conditions under which a person under the age of 18 can get contraceptive care without involving a parent. And that is really if they are legally emancipated from a parent or are married. So there are very limited options for teens in Texas to get care. That said, what is kind of interesting in Texas is that teens can't consent for contraception, but they can consent for pregnancy testing without parental involvement, testing and treatment for sexually transmitted infections without parental involvement. They can even buy over-the-counter contraception, like emergency contraceptive pills, condoms, without involving a parent. It is just the most highly effective methods that teens can't get without involving a parent in their care.
And that's because to get a highly effective method, you need a prescription or something by a healthcare provider in order to access that.
Exactly. This includes oral contraceptive pills. It includes contraceptive injections or contraception implants or intrauterine devices, things that require a visit to see a healthcare provider in order to get.
So they can access things like condoms that are in a grocery store, drugstore, but it's really the most effective methods, ironically, that they're barred from accessing on their own.
Exactly.
So why do we care about this? Why do we care if teens have access to contraception at all?
Well, we know that is just part of human development as adolescent development. You know, teens start becoming sexually active. They know that this is not a good time for them to become pregnant. They want to find contraceptive methods that are more effective than what they can easily get their hands on. And so by not being able to get those methods, it's really putting them in an environment that is increasing their risk of unwanted pregnancies and other adverse reproductive health outcomes like contracting sexually transmitted infections.
What is the public policy reason behind allowing teens access to that without parental involvement?
Well, certainly one of the reasons for teens being able to get testing and treatment for sexually transmitted infections without parental involvement is really related to larger issues about this is a transmissible infection that can be passed on to, other sexual partners. And it's really important for people to be able to come in and get tested and get treatment. And by putting barriers in the way, you are really making it difficult for people to get the health care they need and potentially putting other people's health at risk.
What about pregnancy tests? That's not a contagious disease.
I don't know all of the logic behind some of these decisions, but I would say that for teens who are concerned about whether or not they are pregnant, or for teens who are pregnant, being able to get early pregnancy testing can help them enter prenatal care earlier, start that process of getting health insurance for pregnancy if they are uninsured. So the earlier that teens can get tested, the earlier they can enter care if they do decide to continue their pregnancy.
And do they need parental consent to get prenatal care?
No, teens are able to consent to their own care while they're pregnant.
So a lot of parents would say, if my child has to be involved with the medical system, I should be there with them, and it's my prerogative and my right and my obligation to shepherd them through. How do we respond to those parents who have those beliefs on behalf of teens who can't or won't go to their parents?
Yeah, I think that's a really common response for parents to have, that they, really do want to be involved in their child's health care. I think it's also important to add that there are professional medical associations like the American Academy of Pediatrics, the Society of Adolescent Health and Medicine, the American College of Obstetricians and Gynecologists, who recommend that teens do have access to confidential care. And the reason this is important is because it really allows for more open conversations for teens to have. It can be uncomfortable having these conversations with parents. And we have found in our research that sometimes parents aren't receptive to having these conversations, or they don't have the vocabulary and the information to really guide a conversation with a young person. But being able to have these confidential conversations with a healthcare provider really does provide a safe and open space for young people to start to get this information, and also helps them on the path to their own development to take responsibility for their reproductive health decisions.
In Texas, we often talk about we have the highest rate of uninsured people in the country, including among children. Can you tell us a little bit about who has access to health insurance in Texas in terms of minors? And then let's talk about, if you have health insurance that covers contraceptives, what this parental consent barrier actually means.
Sure. So as you mentioned, Texas does have the highest rate of people under the age of 18 who do not have health insurance. It's about 12% of people under 18 in Texas are uninsured. These are folks who kind of fall outside of the income limits to qualify for Medicaid in the state. So their family still may not earn a lot of money, but they just don't qualify for health insurance, or for whom health insurance to purchase on the marketplace is just too expensive. This tends to, in addition to affecting folks who are lower incomes, we also know that this tends to be more common among communities of color. So Black Texans, Latino Texans tend to be more likely to be uninsured. Now, even the majority of Texans under the age of 18 who do have health insurance coverage, parental consent is still required for them to get contraceptive care. They may have coverage in their parents' private health insurance plan. They'll have coverage if they qualify for Medicaid, but they still are required to have parental consent to get one of these highly effective methods.
So even if you have really good health insurance, you still, as a 17-year-old, can't get an IUD or most oral contraceptives, birth control pills, without parental consent.
That's correct.
What about if you are a teen parent yourself?
Also, if you were a teen parent yourself, you cannot consent to your own contraceptive care. You can consent to your child's health care, but you cannot consent to your own contraceptive care.
Even after you've had a teen pregnancy?
Even after you've had a teen pregnancy, that is correct.
So what do the rates of teen pregnancy and repeat teen pregnancies look like in Texas?
Texas does have one of the higher rates of teen pregnancy in the United States. Texas ranks in the top 10, the teen birth rate, not necessarily the teen pregnancy rate. So teens who've actually had a child. The rate of teen births in Texas is almost twice as high as the national average. And Texas has the third highest rate of repeat teen births. So teens who have already had a child and who become pregnant again and go on to have another child.
And what does the literature say about teens who have babies and the effects on the teen herself and on the offspring?
Well, it really depends on the other circumstances that the young person is in. Certainly, it can be difficult for teens to complete high school if they don't have a lot of social support around them. It can be difficult for young people to enter the workforce. Again, it's very difficult to find affordable childcare for anybody in Texas. But particularly if you're a young parent, it can be very difficult to get the childcare that you need in order to go to work and help support your family. So there are a lot of obstacles in the way. Certainly every teen is going to have a different experience, but it does add some additional challenges to young people who are trying to navigate their way to adulthood.
In your research, and you mentioned this earlier, you have surveyed lots and lots of teens on this topic. What do you hear from them? What do they say? Do they want to involve their parents? Why aren't they involving their parents? What are the obstacles to them to involve their parents?
Yeah, so we have done interviews with teens across Texas who were looking to try to get birth control without involving a parent. And for a lot of these young people, they had already tried to engage their parent in a conversation around contraception and help them get the health care that they were looking for. They were already sexually active. They were using condoms, sometimes using emergency contraception, because those were the methods that were most available and accessible to them. But they knew that there were other things out there that were more effective, that were going to be better for them in helping to prevent a pregnancy that they knew they weren't ready for. So a lot of teens did try to approach their parents, asking them if they could get contraception. And there were really a variety of responses. There were some young people who reported to us that their parent was just opposed to contraception for reasons that were related to their religious views, for reasons that were related to misinformation, that their parent just didn't think that contraception was safe. There were other young people who indicated that the adult that they were living with was supportive of them getting contraception, but they knew they weren't going to be supportive of them being sexually active with the particular partner. Or parents who were supportive of contraception more broadly, but just couldn't get around to making an appointment for them. And they felt that their healthcare was actually being deprioritized. And so we're really trying to find other ways to get contraception that for them was time sensitive.
And what about parents? What do parents say about talking to their teens about contraception?
Yeah, there is some other research out there, just even here in Texas, where parents acknowledge that they don't necessarily have the vocabulary to have these conversations, that it can be uncomfortable for them to acknowledge that, you know, their child is becoming sexually active and growing into adulthood. And they appreciate that providers would be there to have these conversations that they themselves don't necessarily feel able to have.
There's some who might contend that if you make contraception widely available to teens, then they'll think it's okay to be having sex. What does the research say about the cause and effect between access to contraception and teens' decisions to become sexually active?
I think the policy environment makes it more difficult for teens to get access to contraception. I don't think that there's a lot of evidence showing that it is making teens less likely to engage in sex. We have a really complicated healthcare system, a really complicated healthcare environment. It is hard for many people, regardless of age, to understand all the ins and outs of that. And so that goes for teens as well, that they may ultimately find out online that they can't get access to contraception without a parent. But this is usually after they've already started becoming becoming sexually active. And we see just from other surveys in other states that there are similar percentages of teens in states like Texas who were sexually active and teens in states where parental consent is not required for contraception, where the same percentage of teens are sexually active. So there doesn't seem to be strong evidence that the policy environment is changing how many teens become sexually active during high school.
It's just impacting how and whether they can access very effective contraception.
Exactly.
I want to ask you to talk a little bit about Title X. So Title X is the nation's family planning program that was put in place in 1970 when Richard Nixon was president, and it funds all different kinds of clinics across the country to provide contraception and other kinds of services to low-income people. And it specifically does not require parental consent. It favors involvement of parents where that is possible, but it requires that teens be served even if they don't have parental involvement. That's a national program, but that's not the case in Texas. Can you tell us a little bit about that?
So, as you said, the Title X program supports healthcare centers across the country, over 150 of them in the state of Texas. And it really provides key resources to help clinics deliver sexual and reproductive health care to people regardless of their socioeconomic status. And one of the key guidelines of this program is that contraceptive care can be obtained confidentially, not just for young people who can't involve a parent, but this is also really important for survivors of intimate personal violence, that they're able to obtain care and do so confidentially. In December of 2022, there was a case that was decided in federal district court in Amarillo, Texas, decided by Judge Matthew Kaczmarek, that ruled that the Title X program violates Texas's laws around parental consent and parents' rights. And so what this meant was that health centers in Texas that received Title X funding had to start requiring parental consent for young people to get care. This is a decision that right now just affects Title X funded health centers in Texas. It does not affect health centers in other states in the country, of which there are thousands.
So if you're a teen in Texas, whether you're insured or not insured, you have to get parental consent and you have to find a source of contraception.
If you're a teen in Texas, you are able to still go to a Title X funded health center to get contraception, and there are funding sources that can help teens who have limited resources obtain care on a sliding fee scale. But you are required now to have parental consent in order to obtain those methods, whereas a couple of years ago, that was not the case. That was the one avenue that teens in Texas had if they could not involve a parent or if their parent was supportive but just was unable to come in and provide consent for them.
And do we have data on the number or percentage of teens who now access Title X programs compared to before, now that they have to have parental consent compared to before when they didn't?
We are looking into that right now. We don't have any final results yet, but stay tuned.
So there's a bill pending in the legislature this session that would allow Texas teens who are already parents to consent to their own contraception. Good bill, bad bill, what are your thoughts?
Yeah, there have been bills filed in almost every single legislative session, at least since 2015, that would expand the circumstances under which Texas teens could access and obtain contraception without parental involvement. I believe the bill this year actually does not have any preconditions around already being a parent. That has been a condition in the past. But this would really be a game changer for Texas teens to be able to get contraception without parental involvement.
Thanks very much for your time today. Thank you for the paper that you've produced, and we look forward to continuing this conversation.
Thank you so much for having me.
In this week's episode on reproductive health in Texas, we talked about teen access to contraception and why it's important. I hope you'll tune in for the final episode in this series coming next week on the OB-GYN workforce pipeline in Texas and how it's being impacted by the state's abortion laws. Texas Briefing is brought to you by Rice University's Baker Institute for Public Policy, which provides meaningful, nonpartisan policy analysis on the most critical challenges facing the U.S., Texas, and the world. This episode was produced by Karina Zamel with support from Megan Foreman. AV production was led by Kevin Young. You can check out our other podcasts and keep up with our latest research and events at bakerinstitute.org. Thanks for joining us.